Don't scroll. I got something really cool to show you. This is a tip that I learned from a Spinning Babies workshop a couple years ago. If you're expecting or you work with the pregnant population, please stay tuned. Please watch this. If we heard of like small pelvises and the baby couldn't fit because the pelvis was too small and all of that, raise your hands. Did you know that the pelvis is not a fixed bone, that your pelvis actually moves? I want you to get a properly inflated birth ball. That's what I'm sitting on right now. I'll readjust my camera and all of that so you can see me. Or a hard surface, so if that's a chair that's not cushioned or with minimal cushioning. But I want you to get a hard surface to sit on. You're going to take your hands, palms up, and you're going to sit on your hands, okay? Give me a minute to readjust. Palms up, sitting on our sits bones. We're going to feel around until we feel the bones, okay? So if you have some extra cushion, you might need, that's why I say get a hard surface, you know, but you still should be able to feel. You might have to push a little harder, but just push up into the bone, okay? When you feel that, I want you to then, we're going to do this. And first movement, we're going to do, okay? Then we're going to move our knees apart, bring our heels together. And then we're gonna do it again. It's okay, my feet slid. It's okay if your feet slide. Like, find your level of comfort. You should feel your pelvis moving, right? How does this apply to birth? When we're giving birth, often vaginal birth, right, we see feet up in stirrups, right, like this. So knees are apart. If our knees are apart, we're actually closing the bottom of the pelvis. So obviously it's not going to be completely closed, but we are, you know, kind of restricting the space there, okay? When we close our knees, we're opening up the bottom of the pelvis. When baby is crowning and, you know, that's when we're starting to see the top of the baby's head, it's really beneficial to put those knees together, okay? Yes, babies slide out all the time in the knees apart position, but sometimes depending on the size of the baby, you know, we need to make a bit more room. If feet are in stirrups, you can absolutely still have your feet in stirrups. I'm gonna fall. I'm not back far enough. Okay. You can still have your feet in stirrups and then just drop your knees forward like that. On all fours, how this would look. Instead of being like this, you'll be like this. Okay? Side lying, for instance. I'm gonna move my chair. Instead of being like this, I need to get my peanut balls and show y'all those movements too, but that's a different video, okay? So you can take a peanut ball, a pillow, or just the assistance of your support team, whether it's the nurses, your partner, your doula. Someone can then hold your ankles, and then you'll still be able to do this knees together position. Now, when we're speaking knees apart, right? So obviously, you could do this when we're trying to open the top of the pelvis, remember? So any squatty position, even on our sides, again, having something placed between our legs. Remember that when we're talking about labor, it's not just about dilation and effacement. We have to make room for the baby in our pelvis. So movement is important. The baby is moving throughout the labor process. So this is why we need to be moving our hips. Moving our hips. We're making space for the baby. So figure 8 motions, circular motions. We need to be making space for the baby. Okay? If your hips are tight, you need some, you know, practice. You ain't been moving around. Spend time during your pregnancy moving around, moving those hips around, because the baby needs room. I just want to add to this that our cesarean rates, intervention rates are really high in the U.S. Our OBs, our nurses are not trained in physiological birth. That's no shade. That's the system. If I'm shading anything, it's the system. So whether you are expecting, whether you are a nurse, whether you are an OB, I hope that you are able to implement this into your practice. These simple movements can possibly prevent the need for forceps or the need for a cesarean. I have seen this speed up the pushing process significantly. Like, baby slid right out after we made this adjustment. Thank y'all so much for staying this long. Again, share it, like it, engage, use this information.